Hello, residents of Freedom Village. This is John Bruner, your Executive Director. Welcome to the Tuesday, December 15th, Tuesday Talk. So we have a great lineup for today, some important information to share with you. First of all, we're preparing for a winter storm, or as you're watching this likely, we're in the middle of a winter storm. We want to remind you that we are preparing, we're prepared. Rick Devaney, our Maintenance Director, will be joining you for the Tuesday Talk to talk a little bit about preparedness, what we're doing as a community to be ready to clear the snow and make our community safe for passing through and getting into work or having to leave the community. In addition, Stephanie Yateman is our Resident Services Director. She's going to talk a little bit about being prepared for the storm as a resident. Really, really important that we all take some personal responsibility for being prepared for emergencies if, God forbid, we lose power or we're snowed in for an extended period of time. Coming up this Friday, we're so excited as our annual holiday party. We're looking forward to seeing you in at your condos. Our senior staff and many of the management team will be participating in the party and bringing some joy, hopefully, to your door. So we really, truly look forward to seeing you, and we're excited about the party. We're so sorry it's not a traditional party, but it'll be similar, I think, to what we did for the anniversary party over the summer. So what I'd like to cover with you today is a little more details about the vaccination. I'm sure you've been reading a lot, watching the news about vaccines. It's changing literally minute by minute. The Pfizer vaccine last Friday was approved by the FDA under the emergency use authorization to be administered to the citizens of the United States. Following that authorization, over the weekend, this past weekend, shipments started going to states, all 50 states in our nation. On Monday, the Secretary of Pennsylvania, Dr. Rachel Levine, held a press conference in which she explained the distribution process that's occurring in Pennsylvania. Pennsylvania received 97,500 doses, of which all were distributed on Monday to 83 hospitals throughout the Commonwealth. The intent with those 83 hospital distributions is to get it in the hands of our hospitals, our healthcare workers in the hospitals, to be part of that first phase, or phase 1A, of Pennsylvania's vaccine distribution program. And what I'd like to do now is read a little more details about the distribution plan and some information that the Pennsylvania Department of Health has provided us. On Friday, the Pennsylvania Department of Health put out its COVID-19 interim vaccination plan, a 68-page document outlining a three-phase approach to vaccinating the residents of Pennsylvania. The Pennsylvania Department of Health also posted a vaccine toolkit on their website that provides a useful summary of the plan. The following is an excerpt from the vaccine toolkit. Background: getting Pennsylvanians immunized with a safe and effective COVID-19 vaccine is an essential step in reducing the number of virus-related cases, hospitalizations, and deaths. The Department of Health's goal is to have enough COVID-19 vaccine for all residents in Pennsylvania who wish to be vaccinated. The department will use a three-phased approach to distribute the vaccine when it becomes available due to a limited supply. Do I have to get the vaccine? No, the COVID-19 vaccine will not be mandatory. However, stopping a pandemic requires using all the tools available. Vaccines work with your immune system, so your body will be ready to fight the virus if you are exposed. Other steps like wearing a mask, social distancing, washing your hands, and downloading the COVID Alert PA app will help reduce your chance of being exposed to the virus or spreading it to others. Together, COVID-19 vaccination and following CDC's recommendations to protect yourself and others will offer the best protection from COVID-19. Who will get the vaccine first when it's available? The department will work to get the vaccine out to Pennsylvania in 3 phases, following the CDC guidance regarding supply, demand, and risk of the vaccine. When available, the COVID-19 vaccine will be distributed in a phased approach due to the limited number of doses in the beginning. Phase 1A. There will be a potential limited supply of COVID-19 vaccine doses. Initial efforts will focus on reaching the following critical populations: healthcare personnel caring for the sickest COVID patients, emergency medical first responders, residents and staff of long-term care, skilled nursing, and personal care. Phase 1B. Once more vaccines become available, it will expand to additional healthcare personnel with patient care responsibilities, first responders, law enforcement, fire and rescue personnel, critical workers who cannot work remotely or maintain social distancing, individuals with high-risk conditions, and critical workers. Phase 2. A larger number of vaccine doses should be available, and supply will likely meet the demand. Efforts will focus on those involved in broader healthcare administration, critical workers not vaccinated in Phase 1, individuals with expanded health conditions not vaccinated in Phase 1, those contributing to the maintenance of core societal functions, and those at elevated risk due to working or living conditions. Phase 3. Efforts in this phase will focus on the populations who were not identified in phases 1 and 2. Is it safe? Vaccines will play an important role in stopping this virus. It will go through a rigorous approval process before it is distributed. We understand that some people may be concerned about getting vaccinated once a COVID vaccine is available in the United States. While these vaccines are being developed as quickly as possible, routine processes and procedures remain in place to ensure the safety of any vaccine that is authorized or approved for use. Safety is a top priority, and there are many reasons to get vaccinated. Now, once again, that was an excerpt, a long excerpt from the Pennsylvania Vaccine Toolkit, which is a summary of the COVID interim vaccination plan. We will try to make these documents available to you. Later today, I will actually be emailing this information out in one of my memo updates that has hyperlinks to these plans. But I think it's very, very important that all of you be educated, understand what Pennsylvania's plan is, and specifically how that impacts us, how that impacts you as an individual, and how that impacts your decision as to whether you should be vaccinated or not. I think you've heard me say this before, that we and I personally feel this is a very, very important decision that you all, that I strongly urge you all to take. We can't get through this pandemic if a large percentage of us do not get vaccinated. We need to get vaccinated as a community and get through this together. Yesterday, on Monday of this week, Leading Age of Pennsylvania held a conference call. Leading Age of Pennsylvania is an advocacy group for senior housing and long-term care companies like Freedom Village. They pointed out on that conference call that they understand the vaccines administered by CVS would not begin in Pennsylvania skilled nursing facilities until later in December. Yesterday, Monday, we were contacted by CVS Omnicare, and they confirmed the same, which is that the first round of the CVS clinics at Freedom Village would focus on our skilled nursing residents and our skilled nursing staff, those most vulnerable, as the state put in their plan. And that subsequent waves of shipments as vaccines become available would be distributed to the staff and residents of our personal care home, which is the Gardens, and memory care. So it's a bit of a triage, as you can expect. We have a limited supply where we thought we might have more vaccine earlier on. The state has made the decision to focus it in that 3-phase distribution, and within Pennsylvania, they've started in the hospitals in phase 1A. Subsequent waves of phase 1A will come to the nursing homes, like here at Skilled Nursing at Freedom Village. And then as more vaccines become available, we'll start to see CVS distributing them and vaccinating in the Gardens, our personal care home, and our memory care. The leading age call also pointed out that it is not clear where the independent living portion of communities like ours fall within the phases. It would appear to me that it would be part of 1B, but they're trying to get clarification because, like I said earlier, when CVS does arrive, they do not intend on that first wave of phase 1A to be vaccinating everyone here at Freedom Village. They explained they would continue to speak with the Pennsylvania Department of Health to get clarification on that and find out at what point and what phase independent living communities would be vaccinated.
Hello, Freedom Village residents, and welcome to Tuesday Talk. Just some quick updates from the maintenance department. There is a pending weather event predicted starting Wednesday afternoon with possible heavy snow, winds, and possible power outages. So just as a reminder, please make sure that you have your essentials. For example, batteries, flashlights, your cell phones are charged, and you have some water on hand. We will be calling a code blue for Wednesday morning, and most likely mid-morning before the storm starts. Some other things that you may see are the contractors in the hallways, and what they're doing is they're pulling wires to prepare for wireless internet in the future. And they were sent by our home office LCS to prepare for that. So if you see them in the hallways, that's what they're doing. And they'll also be putting up access points, which are little white boxes you'll see on the ceiling tiles. And again, that's to help with wireless internet for the future. So thank you. Please stay safe through the storm. This will come and go, and hopefully by Thursday afternoon be gone. And you'll be able to get out again on Thursday afternoon or Friday. But please try to stay in. Try to avoid travel, as the snow may be heavy and travel may be impossible, they're saying. It just depends on the track the storm takes. So again, thank you, and hopefully you'll have a great day and a great weekend.
Hi everyone. So I just wanted to do a quick friendly reminder again on mask wearing, when to wear your mask during this time, and how to wear a mask and putting it on. So I have my mask on now. So when I want to go ahead and remove it, when I'm back in my condo or for myself in my office by myself, removing my mask, I'll go behind my ears with both my hands and pull it away and put it down. Putting your mask back on, be sure that you're grabbing the strings again, putting it on one ear, putting on the other, making sure it's covering your mouth and your nose. Pinch it to make sure it's nice and sealed up. Any mask is fine, surgical mask. If you have a N95 for, some you're able to get right now, if you have a cloth mask is fine, just always making sure it's covering both your nose and your mouth. We ask that you wear your mask anytime leaving the condo. We ask anytime someone's coming to your door, maybe dropping a package off, delivering mail to you if you need it, that you put your mask on because you're in contact with us. We ask when families visiting that everybody is also masked. Because our families are out and about, we also ourselves are out and about, so we would like for everyone to wear a mask when we're together. Stay 6 feet apart, and that will help, continue to keep yourself healthy and safe. I also wanted to bring up, We're partnering with our Downingtown school, and we are looking for some residents that are willing to write some letters back and forth with students from Downingtown. It's almost like a pen pal, where we're asking some residents who would be interested in being on this list. What we would do is reach out to the Downingtown students. They will write to you starting out, and then you would write back to them. It's for their graduation project. The students usually would come to communities or different areas, but the pandemic has really made it harder for them to do their normal graduation project. So we agreed to have them do a pen pal with our residents here to limit. So if anyone's interested in this, I'm looking for about 5 to 10 residents. If you could please reach out to me, Stephanie Yateman, to let the student know so we can get that started to help them with their graduation project. And they're really interested and excited for this. I know you residents have a lot of knowledge and a lot of information to give to our students to this day. For us as we get older to know what we need to do and talking to them about this pandemic and all. So looking for 5 to 10 residents who would be interested. So if you can just reach out to myself, Stephanie Yateman, you can give me a call at 484-288-2673. So I wanted to remind everyone, in light of the storm that is coming to us this week, some reminders in regards to a supply list. In our resident handbook, we have an emergency preparedness area. So if you go into your resident handbook in section 3, if you go under the letter I, it gives you some things that we recommend that you have in place of the house in light of this snowstorm coming and the potential power outage that could possibly happen. So just some things we recommend is have your cell phone fully charged, have extra batteries in the condo, have flashlights around the condo in different areas for you, shelf safe food, so canned items, any chips, foods that are in bags that will last for a few days, having a little bit extra of that. We also want to make sure that you have at least 2 weeks worth of meds. So we have a little time, if you're seeming to be low, to give the pharmacy a call and have them refill it for you if they're able to. We also recommend that we also have a first aid, so just some little band-aids, any Tylenol, aspirin, anything like that that you potentially could need. So that's just some things we recommend for us in case we do have a power outage. Let's hope we don't, but let's be prepared if not. We're also asking any residents, we have your list if you are on oxygen, but to please just reach out to our wellness nurse, Laura Miller, and let her know that you have your oxygen and that you have tanks prepared for you in case also. You can reach Laura at 484-288-2589. If anybody has any questions or anything that you need in case prior to this, you can give me a call also at 484-288-2673. All right, we'll make it through the storm. We'll make it together. Thank you.
Hello everybody, my name is Jeremy, Director of Dining Services, and I wanted to give you a couple updates for this week. So first of all, with the snowstorm coming tomorrow, we are going to be taking that 5 o'clock delivery and bumping it up to a 1 o'clock delivery. So you can expect it anytime between 1 and 2. Any questions, please call the host desk, please call me, and I'd love to answer those for you. But please expect your 5 o'clock delivery tomorrow on Wednesday during the snowstorm to be earlier than normal. We're really excited for our holiday party. It's going to be a delivery service on Friday. You can expect the first knock on your door around 3 o'clock. We cannot knock on everyone's door at 3 o'clock, but that's when it will start. The first car that comes around is going to be a signature drink from the senior leadership team, so please look out for them. It will then be followed by your appetizers, your salads, your entrees, and your desserts. So we are excited for it. Any questions, please call the host desk or myself. We'd love to answer those for you. Thank you so much. Have a great day.
Hi everyone, happy holidays. I just wanted to remind you all that we are having a Christmas cookie recipe contest. The deadline to hand in those recipes is this Friday, the 18th, and then we will select the top 3 and be handing out cookies next week, the week of Christmas, with the recipes from the residents. So I hope you're looking forward to it. I am, and please get us those recipes. Thank you.
That's all you got. Hello, everyone. Happy holidays. This is Chef Ray here, and I want to say that For all of you who are looking for something special for the holidays, especially around Christmas, Friday is the last day that I can take any special requests as far as shrimp cocktails, fruit and cheese displays, or if you want something specially ordered for before Christmas, please let me know. Also, thanks for all your feedback and your comments. I really appreciate them, and I look forward to seeing everyone soon.
Well, thank you all for joining us for today's Tuesday Talk. I hope you're well. I really look forward, like I said, to seeing you at Friday's holiday party. Stay safe with the storm that's probably raging as you're watching this program. We really miss you all, and we really look forward to the light at the end of the tunnel, which is vaccination of all the residents and staff here at Freedom Village. So stay educated, stay safe, wash your hands, wear your mask. Don't forget to socially distance. We're at the home stretch here. We're going to come through this together, but we still need to be vigilant. So thanks again for joining us today. Have a wonderful day.